Hello, and thank you for joining us for the December Coffee with the Community. My name is Dr. Robert Vogelaar. I'm Assistant Superintendent of Human Resources, and I've invited some friends here to talk specifically about employee wellness, health and wellness and self-care, which is a very important initiative with the school system. It's a part of our strategic plan, actually in multiple places, as we work with our community partners to ensure employee wellness is done as effectively as possible. So I've invited a couple of members of my own department to speak to us today about employee wellness and self-care. That's Rebecca Fisher, our wellness coordinator, and our Director of Human Resources, Dee Rosecrans. And with that, I'll invite them up to present to you.
Thank you, Dr. Vogelaar. Liberty Public Schools understands that an employee's work-life balance can impact overall daily life. That's why an employee well-being is part of the Liberty Public Schools strategic plan for 2022. Our goal as a school district is to increase staff access to social emotional wellness tools by launching a new mobile technology. One of the ways that we will be addressing this challenge is by providing a robust Employee Assistance Program, EAP, for all employees and their families. An EAP is a voluntary program that assists an individual with self-care. Employees can take advantage of free and confidential assessments, short-term counseling, assistance in finding care for a loved one, and follow-up services for employees who have personal and or work-related challenges.
Liberty Public Schools understands that employees' work-life balance, so why is social and emotional well-being and self-care such an important topic for Liberty to tackle? As you can see, as a nation, we are living in a time where the demand for social and emotional well-being self-care services is increasing, but there's just not enough providers to go around. In the past year alone, 56% of Americans have utilized social and emotional well-being services. This number is most likely going to be increasing. By focusing on social emotional well-being services and self-care now, we will be able to provide our employees with all the tools needed so that they are able to get the help they need when they need it. In order to provide a robust EAP and increase the utilization for Liberty School District employees, Optum will be helping us to simplify the member experience by providing a larger in-network provider directory for employees to choose from. They will also include a digital experience with access to EAP through mobile devices, a website, as well as a simple phone call. We will be expanding the EAP awareness by re-imaging what an EAP is, and that it's not just for somebody in need at the moment, but for resources for everybody at any time in one's life. We will also be advocating for access for the right care by providing educational campaigns to promote services that are provided to our employees, as well as provide better explanation of benefits that matches the need for the care. So how are we going to increase the awareness of the EAP? It all comes down to educating, connecting, and acting. We will be providing employees a better understanding of social emotional well-being services and self-care, and contrast the myths associated with those social emotional well-being and self-care stigmas with the truths. Studies also indicate that contact with people actively addressing their social emotional well-being and self-care will lead to significant behavior and attitude changes. We will also advocate that employees spread the word in the community to that early identification and the importance of social emotional well-being services. We need to take a stance and support for a stigma-free society.
Having a simple and streamlined process will make it less stressful for the individual. Access to care when and where an individual is very important. When an employee needs to access the EAP, he or she will utilize the process similar to the one on the screen behind me. The most important takeaway is that the employee is not left alone to figure things out on their own. An advocate will answer the employee's call within 30 seconds in order to assist them in getting the resources needed. Once an employee has reached out to the EAP, it is not acceptable in our minds for the employee to have to wait up to 2 weeks to get an appointment. With the new EAP, employees will have access to providers and to be able to get an appointment within 5 working days. As you all are well aware, the pandemic has brought about virtual everything, from virtual school, virtual doctor's appointments, virtual meetings with employers, as well as video calls with your loved ones. Virtual has just become the new norm. Virtual is not going away anytime soon, and so EAP companies, for example, are implementing virtual into their models to increase accessibility. Access to care is a very important aspect of an EAP.
So when a member is in need, they have 2 pathways to go through for care. They can either go directly to their health care provider. In doing so, they completely bypass the EAP. In doing this, they will be incurring the cost. Or an employee can actually go through the EAP first, where they get 3 free sessions per issue addressed. If those issues are not addressed within those 3 free sessions, an employee will then move on to a healthcare provider. The benefit of this option is that it just delays if or when an employee will incur all the costs for those services. If they're able to address those issues within the 3 sessions, then they will not have any of those costs. Another benefit that will make an enormous impact is that employees will now have access to 256,000 providers compared to the 15,000 providers nationwide that they currently have access to with the EAP that we currently have.
The EAP focuses on 4 areas of support. Employee and family, provides counseling services to both the employee and his or her family members. Opportunities to support supervisors who have to manage difficult situations within the workplace. Work-life advocacy services provide resources to employees. And critical incidents response is available when an incident occurs on a school site and additional counselors are needed there. Within the work-life advocacy services area, an employee will have access to resources that include such things as finding childcare services, helping with creating a will or last testament, financial resources, help with finding a healthcare provider, and even just help finding a great workout facility.
Employers utilizing the work-life services through Optum have seen an overall increase in their EAP usage. More importantly, they have seen that 93% of their employees have felt less stress when they use the EAP services. 51% have seen a decrease in the days impacted by presenteeism, which is when an employee is actively at work, but they aren't able to fully do their job completely. They've also seen a 47% decrease in days that members are absent when utilizing the EAP. The goal of the new EAP is that with the additional resources, such as a new tool called Samvelo, is to double our utilization rate compared to what it currently is. So if services provided by the EAP is solely there to help an individual, why are people not utilizing this? This has to come down to how traditional EAPs are actually promoted. Employees are not aware of what the value is of an EAP. So this is why I will be going out to all of the buildings to have conversations with employees to explain to them what it is and what's there for them. Promotion will not stop there. Visibility is key, so there will be emails, flyers, as well as just building communication in meetings to help highlight what an EAP is and the reminder of the services provided to them. Individuals who were accessing care were also not being connected to the right places. This had to do with the lack of providers. So starting January 1st, employees will have access to over 256,000 providers. This is in comparison to the 15,000 that they currently have. Not only was it a lack of providers, but it also had to do with the tools provided to them. To help fill the gap of this accessibility, digital tools will be put in place to encourage individuals to participate and be connected. Fortunately, even though there is this shortfall, Liberty is still able to have a higher utilization rate compared to the national average of a EAP. The national average of an average EAP utilization is 3.8%, while Liberty is currently standing at a 4.94% for utilization. Even though we're higher, we're still going to be striving to double that rate and encourage our employees to participate by rolling out these new tools available to them. There are 3 different types of EAPs that typical companies use. There's the traditional EAP that focuses on the education for the self-help. Then they can do the counseling either through the phone or through face-to-face. In this new digital world, there's also new startup companies that focuses on more of the individual finding the help for themselves. So this includes just tools and practices for an employee to go on and find the care that they need, as well as virtual visits. Starting on January 1st, Liberty will be unveiling the new EAP, which will be a complete one, which includes everything. So we will have not only the self-help care, which has the education and tools available to them, but employees will also have access to counseling either through the telephone, virtual visits, either through a mobile app or website, or they can do face-to-face counseling as well.
By providing easy access to the EAP and additional services, we are equipping our employees with the tools they need to better manage their social emotional well-being and self-care. Employees will have access to a streamlined navigation system, easy access for care, and additional digital tools at their fingertips.
Employees will now have access to be able to go online and find care. Currently, employees have to call a number to put in a request for services. They now can also go online and personalize their web page based on tools and assessments available to them, so that the vendor will be able to know exactly what the member is needing and wanting at the time. Everything is also in one place. They don't have to keep going back and forth to find care. An employee can log right in, and they'll be able to see and search any topic that they want, at the same time as seeing all the EAP behavioral health care services available to them. When searching for care, it is simplified so that an employee knows exactly what they have access to. This includes a breakdown of benefits available to them, as well as being able to see which providers are in network, their ratings on the providers, as well as all options for visits, including telephonic, virtual, or face-to-face options. Starting on January 1st, employees will have access to additional resources to help them with their social and emotional well-being and self-care. They will have access to virtual visits, either through the website or through an app. They will also have access to Talkspace, which is a texting counselor, and these do not count towards their 3 free sessions that they have available to them. They can use it as much as they want. They will also have access to a brand new self-care app called Sanvello, and this is what we basically call a counselor in their pocket. Sanvello is a self-care app. It's a self-help tool that allows employees to go on and immediately have on-demand services that they can look at, such as meditation. It can have information about loneliness, parenting, tools on sleep, and much, much more. Again, the goal is to be able to double our utilization rate with the additional resources that we will have available to them.
In summary, through this new digital EAP platform, employees will be able to access the toolkit to do such things as view financial well-being video learning series, chat with an EAP specialist, participate in resilience and mindfulness sessions, attend virtual provider visits, utilize text-based provider visits, as well as scheduling doctor's appointments. Dr. Vogelaar?
Thank you very much, Dee. Thank you, Rebecca. I appreciate all your work regarding employee assistance, their wellness and self-care. Appreciate that. And thank you for tuning in and learning a little bit about what the Human Resources Department is doing in that space of employee assistance and wellness and self-care. Thank you.